Welcome, my name is Dr. Brian Lesage, and I'd like to share with you some pearls, maybe some techniques to improve your direct bonding skills. So hopefully you're settled in. We'll spend about 45 minutes to an hour together. Hopefully you have your coffee, your orange juice, whatever you need, a little water. And certainly I need to thank Dental XP for this opportunity. So I appreciate this opportunity to share this information with really your global audience. That's fabulous in these webinar possibilities. So again, welcome. My name is Dr. Brian Lesage. And I'd also like to thank Heraeus because they've helped sponsor this meeting, this session. And so you'll see some of Heraeus' products being mentioned as they've sponsored me for this recording. If we look at composites and composite artistry, or what I like to call many times composite mirroring, here's a case. You can see the before, and then we transition into the after. And you can see with just really what I would call some simple bonding. We just bonded the lateral incisors on this case. And look at the tremendous improvement to this patient's smile. But just direct bonding of the laterals. Let's just look at the before one more time so you get the feel for, there's a lot of visual tension in this smile. And all of a sudden, as I said, how long does this take you to do? Transition the smile, though, very, very minimally invasive, which has really been my philosophy of dentistry my whole career. 1987 is when I stopped doing amalgam. So 1987, I stopped doing amalgam. So I believed in adhesive dentistry for that long, and have practiced adhesive dentistry, and really, what's the kind of catchphrase today of minimally invasive dentistry? But let's just add back missing tooth structure, diseased tooth structure, unsightly tooth structure. Let's just add it back, and it certainly can be done by many with composites in a beautiful fashion, and others rely on ceramics, and there's indications, obviously, as everyone knows, for both. Both have certainly very important roles in our restorative treatment planning. I'm going to share with you techniques, not so much a planning sequence today, really, but some techniques here. Hopefully that will help you, aid you, again, in moving to the next level and becoming a better direct bonder. As I mentioned, Heraeus is sponsoring this, and you're going to see really me doing cases with Heraeus Venus Diamond, which is a very nice nano hybrid material, and also Venus Pearl, which again is a nano hybrid material. And they've tried to change the particle size, really trying to accomplish polishability in these. So if you've heard me speak before, one of the things I like to talk about is the eyes can't see what the mind doesn't know. So the eyes can't see what the mind doesn't know. So hopefully I'll be able to open up your mind a little bit, both from a technical standpoint and then also from a artistic. These are fabricated with some creativity, as in the title here, 3 C's, contour, color, and creativity. So that's really what we need to be thinking about. It is an art form, and it certainly is tremendously science-based, but let's not forget about the art portion of this one, fabricating these restorations. So as I said, 3 C's, composite, mirroring, contour, color, and creativity. And when you look at bonding, and you look at direct composite restorations, what is their success based on? Is it really material-driven, or is it technique-driven? And I think most of you, if you thought about it there for just a second, know that it's obviously both. It's not like you can just pick up one magical material and become absolutely just the best bonder in the world. It isn't. That's not going to happen. You need to work with that composite. You need to work with that composite system and understand their dentin shades, their enamel shades, and how these two, when put together in a certain fashion, a layering type technique, that you can create incisal effects, incisal translucencies. You can create mamelons and lobes and translucencies that you may want interproximally. And then working through finishing and polishing stuff. So certainly materials are important, but truly if you look at most major manufacturers, they all have really a very nice composite materials. And then certainly technique, and there's multiple of us that love to teach composite techniques, and all of us teach similar philosophies. But certainly it is no question, to be a good, successful bonder, you need to understand the materials from an optical and physical standpoint, which one maybe is the best one to choose for that case, and also techniques play into that. And that's what I hope to share with you, a couple little tricks, if you will, in becoming a better bonder. So when we look at materials, right, and techniques, this would be a full day lecture. I need to cover all of these, all 5 parameters here, and others, of course, but these are the main 10 parameters I do in an all-day lecture. In this 45 minutes to an hour that we have together, I'll be able to cover on there. So, I started to talk about it's important to pick a material, the appropriate material for this, for the restoration that you're trying to fabricate. And so classically, we have had microhybrids and microfills through the years. That's really what we've been working with for many, many years. Since really, I'd tell you, the early 80s, when we had really decent about it. But today, we certainly have a new category called nano. The trick here is the advantage, maybe, of the nanohybrids is what we need to be thinking about. So what is the advantage of a nanohybrid? When you think about the difference between a microhybrid and a microfill, microhybrids are known for their strength. So I think everyone knows that. So microhybrids are certainly known for their strength. So you want to put those in more stress-bearing areas, right? Which is really why when I stopped doing amalgams in 1987, that I used microhybrids, and I've used microhybrids on posterior teeth ever since. And then the microfills, the advantage of the microfills, though, is for low wear and high polishability. And really the maintenance of the polish is the key word there. So you have microhybrids known for their strength, microfills known for their low wear and high polishability. And really what the nanohybrids, the goal with the nanohybrids was to make a material that met both those criteria. So really had both those advantages. And and they've gotten very close. The first really nano-filled material, probably introduced, my understanding was introduced in about 2003. That was 3M's product in 2003. And as I said, now all the manufacturers have that. And Heraeus has a very nice material. Venus Diamond is a very nice nanohybrid material. And now they've just developed, in the last year or so, Venus Pearl. Which probably has a little better, you can polish a little more easily and probably maintains that polish quite nicely. So that's a little bit of the history to microhybrids, microfills, and now the newer classification, just to make sure you understand where these materials came from and why. So if you look at composites, the goal that I'm always thinking about when I'm doing composite artistry or composite mirroring is the goal that I'm always trying to pull off here is can I match the tooth in color and translucency is really what I'm trying to do. Does it have the strength to hold up, under function, under load, for the long term? For the long term, a key point, are they seamless and undetectable? So are these restorations seamless and undetectable for the long term? And do they have the appropriate luster and polish? And do they maintain that luster and polish for the long term? Right? And as I've been alluding to, there really is no really magic bullet still. Right? So we still don't have a material that can do all of that. So we've gotten closer. There's the reference on Mitra, who's really the chief chemist, I believe, behind 3M. And you can see the release date there pretty much was this new material came out in 2003. So this new classification of material came out in 2003. And, so now we're about 10 years later, and certainly all the manufacturers pretty much have a nice nanohybrid. The key really to being the key to being a very good aesthetic dentist, a cosmetic dentist, you call it what you like, is to really understand aesthetics and really understand white aesthetics. And so right here, I just have a couple of the concepts of white aesthetics. Do you know what a tooth looks like? And so I'm going to take 5 minutes of your time. This is a 5-minute section on white aesthetics out of really almost an all-day lecture that I do on smile design, and a nice article that I did out there with Luca Dell'Acco, a European colleague, Italian dentist ceramist, in the Journal of the American Academy of Cosmetic Dentistry on smile design. It's kind of a fun little article. We talk about mathematical formulas, and we talk about artistic interpretation. So we cover both sides of aesthetic dentistry, smile design. So let's just peek into this window of smile design, because when we're doing direct composites, we are replacing white tooth structure, or we are adding to white tooth structure to change the contour, to change the axial inclination, to change the size of the ledge, to change embrasures, right? To change the facial surfaces, the profile of the teeth. So we really need to have a good understanding of really truly what a tooth looks like. And sometimes we maybe have forgotten that. And what makes this tooth look like a tooth is certainly outline form. The outline form and the line angles, that's really what gives a tooth its shape. And so we know basically what shape we like teeth to be. And the line angles, though, they're not straight. They're not straight. Nothing is really straight in nature. So we're looking at S-curves on the teeth here, the reflective surfaces, and reverse S-curves. That's really what we see when we're looking at teeth. And so that actually defines the reflective surface and the facial plane of this tooth, so the width of that tooth and the shape of that tooth. And then the deflective surfaces are from those S's. Many times those areas have good translucency in them. And the numbers actually in the lower right-hand corner, which you're seeing, I should reference for you, really, those are AACD numbers. Those are the criteria. Those are criteria numbers in the American Academy of Cosmetic Dentistry's accreditation process, right? So 43 are the line angles developed appropriately. That's really what 43 is. 86 and 87 are the teeth symmetrical from right and left? Do they have reasonable symmetry from right and left? Okay, and so if you're interested in the American Academy of Cosmetic Dentistry's accreditation process, the numbers you may find a little bit beneficial. If you're not, just ignore those numbers. So don't worry about those numbers down in the lower right-hand corner. And so then we look at the profile. So we look at, line angles, outline, form, really, initially, right, to get the initial shape of the tooth. And then profile, we all are very aware that teeth have 3 facial planes. The teeth have 3 facial planes, and that's going to control the length of the tooth, the color of the tooth, the gingival health, and certainly plays into certainly a occlusion. Certainly doesn't it? So those would be the parameters that we need to think about when we're looking at the profile of these teeth. And then tooth proportion. We all know that everyone's very familiar with 75 to 80%, 75 to 85%. This tooth, this patient, you can see is 10 millimeters long and 7.5 millimeters wide. And so that's kind of an ideal with the length ratios. That's an ideal with the length ratio. And that's number 46 when it comes to the AACD criteria. So that's number 46 is the with the length ratio appropriate. Is it appropriate for these cases? And then you look at tooth symmetry. So now we were looking at tooth number 8. Now we're looking at tooth number 8 and 9. And is there reasonable symmetry between these teeth? Reasonable symmetry. Symmetry is not a word that we should be using a lot in dentistry, right? Because Mother Nature is not symmetrical. If we're really trying to mimic Mother Nature, then there should be, some perfect imperfections, right? Some perfect imperfections. Certainly as Bob Stein described it in the 80s. Loved his lectures on tooth anatomy and contour and such. So you can see the reverse S-curves and the S-curves here on these teeth. Again, describing the reflective surfaces of these teeth, the facial profiles of these teeth is what those S and reverse S curves will help us with. And so even though I put tooth symmetry, we're not looking for perfect tooth symmetry. We're looking for some harmony and balance is really what we're looking for there. For the first premolar, and you can see the axial inclination. What defines the axial inclination is something that you need to know. And then the picture on the right here, you can see with a case, it's an older veneer case that I did where the axial inclinations are set up, certainly much more ideally, probably too ideal really, that kind of smile design cases I've moved away from today, setting them up that perfect. I don't think that's what our patients want today, but you need to decide that with your patients and their goals and expectations. And then you look at golden proportion, right? So golden proportion, everyone knows sort of that. And in 1993 shared with us really that it doesn't exist in nature, and you can see the numbers that he found in his study, which was the laterals only fell into this golden proportion ratio 17% of the time, and the cusp is zero. And so I think it's a wonderful guideline. Get you started if you're doing 6 teeth or 8 teeth, something like that. So a good place to start. But I would strongly recommend not hanging your hat on golden proportion because it doesn't exist in nature. And I know there's some controversy out there when I say that. But check the literature sometimes. Check the literature. How we teach it at UCLA really is we like to see the laterals. Certainly falls into very close to golden proportion, so 65%, no problem there. The laterals, and plus or minus male or female patient is what I like you to think about. And then the cuspid, though, really is very different here in this scenario because it falls into 75% the width of the lateral. And I'll even tell you to go 75 to 85% the width of the lateral, maybe depending on if it's male or female, maybe depending on if you want a stronger smile, sort of a more masculine maybe smile, but maybe not. It works in females also. So I'd encourage you to rethink maybe golden proportion, maybe look at the literature there. And so that was a very quick, as I promised you, just a very quick, because it's a composite lecture, very quick overview of white aesthetics, but that's what we're doing. We're talking about composite mirroring, right? We need to mimic, we need to really mirror tooth shape, tooth, the axial inclinations, tooth size, tooth proportion, tooth symmetry, midline. Certainly, golden proportion, as I said, really better described as central dominant, smile line, cants. Right? All those parameters really play into this very, very crucially, axial inclinations also. So, just a very quick overview on smile design. So, and then just to kind of get our eyes freshened up here, here's a composite I did. You can actually see the dates on it. That's one of the things I liked about slides. So 1999 did this case, and see the gal chipped her lateral incisor number 10, or for the international colleagues 2-2. And you can see what I was able to do here. So really trying to steal from Mother Nature. Look at the embrasure form that I created here between the central and lateral. Does it mirror somewhat the embrasure form here? And certainly this patient has an interesting axial inclination, as tooth number 7 or tooth number 1-2 is really tipped facially, which is really kind of somewhat of a nice look sometimes. And interesting though, the result, I create a decent line angle here. Does this meet those 4 criteria? Does it match the tooth in color and translucency? Does it have the strength for the long term? So you don't know that unless you know what material I used. All right, so this was actually done with a microhybrid laid down and a microfill laid over it. All right, that's how we used to kind of do it in the old days, if you will. Now you can just grab now you can just take a nanohybrid, a nice nanohybrid, just like I'm going to show you here, Heraeus' Venus Diamond or Venus Pearl, and do this really in with one material. So does it have the strength? Yes. Hopefully pick the right material there. And then is it seamless and undetectable? So I think we'd all agree that's pretty seamless and undetectable. And does it have the appropriate luster and polish for that patient's dentition? And I think it meets those criteria quite nicely. Interesting thing with this case, as you can see, again, 1999, we did this case. So literally last year, in 2012, she signed up for Invisalign. We started her on Invisalign. So these cases, sometimes they develop slowly. Certainly I recommended Invisalign at the time we did this procedure, and the patient opted against it. But so no many times means no, not for now. Doesn't mean no, not forever. It just means no, not for now. It doesn't fit in their life, doesn't fit financially, a lot of reasons, but certainly revisit these options with the patients, and many times they will turn around. So let's look at a couple of the parameters. Right? I told you I was going to share with you a couple of key tools of what is necessary, is needed for attaining these seamless restorations. So one of the tricks is a putty matrix. So many of you have heard about using a putty matrix. Many of you probably use a putty matrix. This could be certainly repeat material. But a putty matrix for me is very crucial. It's the starting point. And here's really the deal. Here's the take-home message with the putty matrix. Here's the take-home message with the putty matrix, which is you really want to capture the lingual contours of the tooth. So the lingual contours of the tooth, as I'm showing you with the arrow here, and then the incisal edge plane. That's really what it is. And then the embrasure forms you want to capture with this, and the facial incisal line angle. So those really are the 4 landmarks: the lingual contour of the tooth, the incisal edge plane, the embrasure form, and then the facial incisal line angle. These are the zones that you want to capture and recreate, use as a guide with the putty matrix. So this can be done directly or indirectly. Certainly directly or indirectly is what can be done here. So directly meaning you would do a mock-up. The patient comes in with a chipped tooth, let's say the gal that we saw before, and you mock it up. You mock up the lingual contour. You get the embrasure like you like it, the incisal edge plane, and that facial incisal line. You don't know where if it's seamless or undetectable on the facial surface. You capture those 4, right? And then you make a putty matrix. Now, Horaeus has a great putty matrix material, a FlexiTime, PVS material, FlexiTime, works fabulous. But you can use any other manufacturer's PVS material, whatever you have will fine. And so you can create that in the mouth. Then you just chip off that little piece, and then you start creating it with this restoration by using the putty matrix, And how would that work, actually, is you would just put the putty matrix outside the mouth. You put a thin amount of material in the putty matrix, okay? And we'll see a case of this in the presentation. Thin amount of material with the putty matrix, over here on the lab bench, whatever, you put a thin amount of material in here, and then you etch and prime and bond the tooth, and then you bring the putty matrix out of your dark where you're keeping it so it doesn't cure, bring it to the patient's mouth, put it in the patient's mouth, right? And make sure, obviously, that the composite sticks to the tooth here and cure that. And then you start building up. With probably a dentin shade, okay, your dentin substitute composite material, and then some translucent shade, maybe some tints, and then some facial enamel. And that we'll get to here in just a second when I talk about layering composites. So we'll see this and revisit that concept a couple of times here. Key point here is really making a putty matrix. So as I mentioned, you can make it directly in the mouth, just as I described to you, or you can do it indirectly, where you take a study model of that patient and you mock it up outside the mouth. You can use your expired composite to mock it up outside the mouth, or you could do a diagnostic Raxa. You could even send it to your ceramics if you really wanted to, but there's really no reason to do that. But you can mock it up outside the mouth, make your putty matrix, and then go ahead and do the procedure intraorally for your patient, either that same day, or certainly it could be scheduled at a more convenient time if your schedule is full and busy that day. So that's how the putty matrix, very important starting point, because now you have three-dimensionally the starting point for contour, color, and creativity. And so let's look at a case. This young lady comes in, and as you quickly look at her, you go, wow, she's a pretty young lady. She's 13 or 14 years, what she is, right? And she's post-orthodontic, so this is orthodontic treatment has just finished, and this is where she's left. Now, I didn't have anything to do with this case. I inherited this case. She heard I was a good bonder, and so she came to me for bonding. I personally would have done some things differently, honestly, if I was working with the orthodontist, but I didn't have that opportunity to be able to guide the orthodontist, maybe in a discussion as to how we could maybe set this case up a little differently. But anyways, here's my starting point. And a delightful young lady and her mom. They're very nice people as they come in. And if we look a little more closely now, you might start seeing some things that you go, you don't like so much. Her issues. Can you guess what her issues are? Yeah, exactly. Her issues are tooth number 811 is too short, and the canines are very fangy. Okay, so she looks like she's got very prominent canines. A very kind of aggressive look, as if you look at Age, Gender, and Personality by Richard Lombardi's work in the 1973 Journal of Prosthetic Dentistry. And so she doesn't like that. For me, much of what I see is the pink aesthetics, honestly. I see the asymmetries in the pink aesthetics, which I find very offensive in this case. So the asymmetries from right and left really is a bigger issue. But obviously the pink aesthetics plays into the white aesthetics, and there's where that great mingling of aesthetics and understanding of aesthetics is so crucial. But so I give an option of maybe trying to improve their pink aesthetics, and they have no interest in doing that. So I'm left with trying to create a better white. This is a little bit, let me go back just a second. This is just a little bit tricky case. Look at the incisal halo. Look at the incisal translucency on this case. Very, very challenging. And then here we are now. Here we are doing the technique. You see Teflon tape protecting the adjacent teeth. So Teflon tape protecting adjacent teeth. And then the putty matrix here. So there's the putty matrix, and that was, over on the side here, we did a mock-up, made a putty matrix, and then we put a thin amount of composite. You can see the thin amount of composite on this, and trying to get the appropriate length, the lingual contour, the incisal edge plane, the embrasures, right, and the facial incisal align angle, capturing those 4 anatomical landmarks. And so we built that up. Excuse me. And so there you can see this lingual shelf, if you will, allowing us to three-dimensionally recreate this tooth in color and contour, and then hopefully adding a little bit of creativity in there. And so now we start to bulk up. We start to strengthen that incisal edge, this additioned material. And you can see I've left in lots of zones and areas for incisal material to go in, because she had a very prominent, very really kind of cool, if you will, very though advanced incisal translucency. Very difficult, very challenging to reproduce the incisal translucency that she had. So there you can see I've placed a lot of incisal translucency on this tooth. Normally I wouldn't probably use quite that much, but every tooth, every case is different, so you have to really kind of color map this for yourself. So incisal clear, in this case, is what I happen to use, and then you'll see in a couple more cases how I decide that. Excuse me. And there is the final restoration at the first attempt. Okay, so what I mean by that is these cases I do in 2 appointments. These cases I always do in 2 appointments. So I get the case about 80% there, and I'll let you see what I'm talking about there. Get the case about 80% there, which is what this is just about. Is maybe a little further along than that. But I get it to 80+% there, the first appointment. I have them come back within 5 days, and add a little bit, take away a little bit. In this case here, as you look closely, there's actually a little tiny void right here. Tiny void right here. So I'll have to go in and fix that at the second appointment. So that's very easy, just to take away that little area there. Right? And really best, I think, to sandblast it and then etch, prime, and bond, and then add your restorative material. So there's a little tiny void there. You'll see that. And there she is. That's the day of. Again, you can see a little tiny void right here. Little tiny void, and then we'll correct that. Very simple to correct that at the second appointment. So sometimes you'll get little voids, sometimes you won't like the contours exactly, and so photography is really going to guide you in these cases. All right, so now you can see does the translucency of this case, does it mirror the adjacent tooth? Does the texture, does it have the 4 parameters we talked about? Does the restoration match the tooth in color and translucency? Okay, we talked about does it have the strength for the long term? Is it seamless or undetectable? Okay. For the long term, is the appropriate luster and polish on the cuspids also. So the cuspids have been softened and toned down on the cuspids. And so there's the case there with really some nice translucency and incisal edge halo that we're able to create in this. I think we'd all agree that's a pretty nice bonding. There's her smile now. Okay, there she is smiling now. The canines certainly look a lot less fangy. I think now when you look at the case, though, see, for me, the pink aesthetics really sticks out now. So the asymmetries in the gingival tissue are really just what stick out for me. Patient didn't really see this. The mom didn't really see this. So fine. They go on. And very, very happy with the outcome here. So here you have the before of this case. Right? You can see the canines, the rotations in the canines, and then the length. And watch this morph into the after. Okay, so I think you all agree that we got a pretty nice result for this gal, for this young lady. So there she is before. You can see the visual tension, and there she is after. So really, what we call harmony and balance. Harmony and balance. Okay, so first principle that I shared with you is really the matrix. Now the starburst bevel. Starburst bevel, looking at a case here. You prep the tooth, you take the decay out, and this is a class 3, but this could be a class 4. Could even use the same technique for a class 5. Here's a reference to a chapter in a book. I'll give you a reference. I'll give you my email and my website at the end. I'll tell you my website now, which is bhide.info. bhide.info. And I have many articles. There's 15 or so articles on there, some on composites and some on veneers. So if you want a reference there, obviously they're all free downloadable articles. And so here we're looking at the classic bevel that we classically put on. So a 45-degree bevel, 2 to 3 millimeters. That's what pretty much everyone teaches. And then really what I call, maybe coin the term starburst bevel. Starburst bevel. And so this bevel, what does it need to do? It needs to vary. Right? It needs to vary in depth, length, and volume. So that's what it varies in, is depth, length, and volume. So there are bevels in bevels. So some of the bevels are going to be longer, some are going to be deeper, some are going to be wider. So they need to vary in depth, length, and volume. So bevels inside of bevels is really what this is. And this is really going to allow light to enter the tooth and bounce around the field, refract, be absorbed, right? And not allow our eyes to be able to tell where that margin is. And this is a very good technique, right? I promise you, try this technique. Now, I'm not saying destroy the tooth either. Okay? So I'm not saying, put these huge, deep, crazy bevels in it. So try to keep it subtle. I think you'll see here. There you can see the starburst bevel a little bit better with a bonding agent on it. So you can see that some of them look a little deeper. You can see the deeper ones here, but you can't see the smaller ones, and you can't see the bevels in a bevel. So that's the dentin shade there that's put in there. And so we put the first layer down, the dentin shade, and that's really important layer to put in. You need something with some decent chroma, some decent opacity to block out the show through. And so you can see how we've taken it up to the bevel here, and we've really kind of masked out the dentin shade, and it really pretty much needs to look seamless at this point. And now you're going to put it with the enamel shades to really modulate or adjust or act as a filter for the value of this tooth. And there's the enamel shade over that. And so you go from before to after with trying to again mimic the appropriate luster and polish, and you can see that restoration is pretty seamless. So think about that starburst bevel there. And then we get into layering. So the third really system that I think is very important to become a good bonder is to understand layering. So we talked about the matrix, how important that was, and then the starburst bevel, and now we have the layering technique. So Silas Duarte taught this concept to us, shared this concepts with us. And so we talked about a dentin core. Now if you look here, we're taking a very dark tooth here. Right? And we're going to try to make it an A1. And we'll see a couple of pictures before and after. So what am I doing here? Well, the top picture there under dentin core, I'm actually putting an opaquer down there. Similar to a ceramist when they do porcelain metal crowns, they put an opaquer down. And the bottom one, we're using more of an opacious dentin shade, so dentin shade material. And then we're putting artificial dentin over that. So now we're starting to warm the tooth up, warm the restoration up, really is what we're trying to do here. Again, think about what a ceramist would do on a PFM. Right? So I started putting in some dentin shades there. And now we're putting in some tints. So we may put some tints in, and then incisal opalescence or incisal translucency, some type of incisal shade, some type of translucent shade. You call it what you like. Every manufacturer calls it slightly differently. Silas described it as incisal opalescence. I like that term. And then you put your facial enamel over that. All right, it's facial enamel over that. And so we really took this dark tooth, this dark stump shade, which is really, this I believe was 5M1, I believe, in the 3D Master Shade Guide. And this is I think this is actually A1. I'm not positive of that. I think this is A1. It could be A1 or 1M1. Very similar shades. And so we want to really take this 5M1 and take it to a 1M1 is really what we're trying to do here. And did we do that? I think you can see that we've done a pretty good job blocking that out and really highlighting and lightening that. And look at the incisal, if you want to look at the picture on the right or left. And look at the incisal halo. Look at the incisal translucency. Look at some of the texture, the reflective surfaces and such. But we're taking a very dark tooth and brightened it up quite nicely doing direct composites here. And if you look at the value, so if we desaturate it and we look at the value, then you can see, again, how we got this tooth that was pretty dark and really brightened it up, made it pretty bright. And it's got different value zones in it also, which is so crucial. That's what teeth do. That's the creative part, contour, color, and creativity. Right? And so if we look at one more concept here, which is undetectable margin. So we've talked about a couple of these, which the first one certainly place a proper bevel. Well, we're talking about a starburst bevel there then, right? And then you etch past the bevel. So you place the proper bevel, etch past the bevel, then roll that outer layer in clean gloved hands. So you want to roll the outer layer in clean gloved hands. That just gets rid of those inclusions, the cut marks as you cut through composite. You've all seen that white sort of chalky edge that you get. And so that, if you put that on the tooth, that can become a void. So you roll it to get rid of those inclusions. And also, it also makes the material flow a little bit better. It doesn't really flow, but you can sculpt it, you can push it where you want it a little more freely. It's warmed up. It's warmed up, so it flows a little better for you. Then supercure the composite, all right? So supercure the composite, wait 5 minutes before finishing. Let the reaction, take place. And before you go, call your stockbroker. I don't know what you want to do. Call your wife, your spouse, your girlfriend, whatever the deal is. Go do a hygiene check. Do something. Let the composite just relax for a couple minutes before you start hitting it with finishing burrs. And then the best finishing burr to really start touching this with is a fine diamond. A fine diamond, and I'm going to show you that in the finishing and polishing section. A fine diamond here. So be careful with that. I have a nice article on the website on beehide.info, so www.beehide.info, that I did for the AGD on finishing and polishing, talking about looking at the literature as to what's the best finishing and polishing sequence and the best burrs to use. So you might want to check that out, reference out. Finish the margins back to between the etch and the end of the bevel. So take that material and finish it out between the etch and the bevel, what I call finish to infinity, finish to infinity. Rotate the armamentarium from restoration to tooth, so when you have your disc system, have it spinning from restoration to tooth. And don't use rubber on the margins. That's my preference. Some people teach it otherwise, but I'd like to see don't put rubber on the margins if you can help it. That rubber, for some reason, those little pink, green, blue, whatever color the rubber wheel is, or point, whatever you're using, tends to find its way into the margin, and that can be then kind of frustrating, trying to get this all cleaned up and such. So just a little point that I like. And then get the appropriate luster. What most of us somewhat struggle with, it is the hardest thing we do when it comes to mastering composite artistry or composite mirroring, right, is finishing and polishing. Because so many times we get we look at it, we got the right outline form, and we start putting in a little bit of anatomy, a little bit of texture, and we're very happy. We're very pleased, and then we start polishing it, and then the texture goes away. And we go, it looked good 5 minutes ago. Now it's too polished, or it's just got too flat of a surface. And so that's not what teeth look like. And so let's walk through the sequence, which is standing continuums running in the country. And so Brasler office, I don't get anything for this burr kit. They do give me free burrs, but I don't get any money for this. This is, though, if you look, that's about as well polished as you can get it, and that's not going to be acceptable for very few patients, probably almost no patients will you be able to just use that burr kit and get the appropriate luster and polish that you're looking for, but you can get it that far, and then use someone's disc system. So you pick the manufacturer. There's lots of them you can see down there. I've got multiple. I've got 3Ms. I've got there is Brasslers in there. There's Cosmetids in there. There's Dentsply, Ivoclar. Everyone really has a pretty reasonable, pretty nice disc system. You pick the one you want, and there's the luster. There's the luster that you can get off of a disc system. So that's pretty high luster, and that'll work for many patients. And then, if you really wanted to get it, the patient requires, it's indicated to take to a very high luster. That's total polish there. Okay, that's total polish. That's not faking that, artificially doing something, putting some glaze or something. That's a total polish. And that's really using what I really like, which is this goat hair brush here. It's a goat hair brush with a chamois in the middle. So it's a goat hair brush with a chamois in the middle. The only manufacturer that makes that is Brasler. And I say unfortunately because when I give lectures, I do always like to give you two options of someone else who may make that. So you can buy a chamois brush, though, by other manufacturers, and a felt brush by other manufacturers, though, certainly. But I believe Brasler is the only one that makes this goat hair brush with the chamois in the middle. So that's my favorite, though, because the goat hair brushes tends to get a little bit more into the texture, the dots, the lines and such that you've created here. You need to use that with a polish. Is very much the crucial part of this process, finishing and polishing. Let's not forget the other ones, though. Remember, the matrix, very important, starburst bevel, and a proper good layering technique gets us, partway home. But now finishing and polishing is really going to take this and meet those 4 criteria that we laid out in the beginning. And so, as I said, it's a Brasler burr kit. And phase 1, what I call phase 1, is we're really trying to get contouring correct, the outline form of this correct. And we're using that 8863012. It's a red striped diamond, a fine finishing diamond, right? A fine finishing diamond is what we're talking about here. And that will get me almost 80% there. I can get about 80% there of the contour of the tooth using the red stripe diamond and a coarse disc. You pick the manufacturer. You pick the manufacturer of the coarse disc, all right? The disc system that you want to use. And so get the restoration about 80% there is really what we're trying to do. So a red stripe diamond and a coarse disc, and you get a good outline form, good 3 facial planes, all the parameters we talked about in white aesthetics at our brief section on white aesthetics. So as we now have, very close to the right outline form here, and then we want to apply some texture. We want to apply some texture. So I like to use the 6856L020. That's the large diamond that's in the front row. The prepping diamonds are all in the front row. And then we got finishing, and then we got polishing in the back. But I like to use this middle one here. It's 02. It's a large green striped diamond. I like to run it ideally in a slow speed or in a high speed, but with electric hand pieces is what I really prefer. I happen to use NSK's Brasser's electric hand pieces, which I love. But I know Cavo makes good electric hand pieces, and there's other also very nice electric hand pieces out there. But electric hand pieces really help with composite artistry, because you can turn these down, you can dial them down, and then I can just kind of kiss the surface with this coarse diamond and get striations across the surface, get striations in the grooves, in some of the undulations that maybe you built in the primary anatomy. So I also use this 557 burr, sometimes the side, sometimes the sort of the edge of it. Right? I also like to use a round burr. Also, sometimes we'll use a round burr, so a large round burr, maybe a small round burr, and again, sort of kiss the surface, run the burr across the surface, trying to create some pericomata, some irregular surfaces in this, so that sometimes works out well also. So get your contour really dialed in sort of in this phase, 80% or so contour outline form, and then go ahead and add a little bit of texture, the appropriate texture. You're trying to mirror the one's disc system. You pick the disc system, either one, any manufacturer's disc system, and that's about where you'll get. So you might do a little bit. So what do? Well, you reapply the texture. At this phase, you reapply the texture. So now you have your outline form with the coarse disc and medium disc. You have it 90+% there, your outline form. And as I said, you've polished that facial surface, and you've probably removed a fair amount of the texture, and now you reapply the texture. And so that really gives you a good guide there. And then you can go ahead and use maybe a little bit more medium, but you got to be careful with that, and then probably you're going to go to a fine disc at this point. Probably a fine disc at this point. And let me say something about discs, actually, because many times you can't get this kind of polish, even what I demonstrate here, which is pretty nice polish, right? You can't get that with one coarse, one medium, one fine, and one extra fine. That's not possible. Right? You need to use, you probably use 2 or 3 courses. You may use 3 to 5 medium discs. Okay, you may use 2 to 3 fine discs, maybe more, maybe 3 to 5. The super fine, you may only use a couple of those. Other tooths are a little bit different. I don't use a lot of super fines, to be honest with you, because I really pick up the super fine process in the next phase, in the polishing phase, using my goat hair brush. All right, using my goat hair brush with a chamois in the middle. That's very, very good, super fine, with some nice composite polishing paste. You pick again the manufacturer. The one I happen to use is Enamelize, but Ultradent has a nice polishing paste. Dentsply has a nice polishing paste. I believe Ivoclar has a nice polishing paste. So you pick the composite polishing paste. You could even use porcelain polishing paste if you want it. Probably a little bit lighter touch if you use porcelain polishing paste, but it works also quite well. And so we have the porcelain polishing paste. Something else that's here are these silicone, really are the silicone brushes here. And these silicone brushes and points, those work actually quite well also. And again, in the manufacturers I mentioned, I think Ivoclar, Ultradent, I think even Brasser. I mean, a lot of manufacturers make these silicone little brushes, and those kind of work pretty well also. But again, my favorite really is the goat hair brush with a chamois in the middle, classically with the polishing paste. And you can get, this is, I think we'd all agree that's a very nice luster there. So that's really our goal. So think about the 4 steps here, the 4 techniques that I think are crucial. Putty matrix, guiding us with contour. Right, establishing the lingual contour, the size of ledge plane, the facial and size aligning, or the embrasure form. So the matrix, very crucial there. Then the starburst bevel, the bevels in the bevels, varies in depth, length, and volume. Then we go into layering technique. Sometimes you'll only use 3 layers, sometimes you use 4, sometimes you may need 5. Right? But you decided based on your color mapping and looking at the adjacent tooth, whatever you're trying to mirror. And then lastly, the finishing and polishing. When you get the outline form correct with that 8863, the red stripe diamond and a coarse disc, get that outline form correct, and then you go into finishing and polishing. Put a little texture in that first phase. Then when you use the medium disc, you loosen the texture, so you have to reapply the texture in the finishing. And then you go into the high polishing phase, right? And hopefully then you get a pretty seamless and undetectable restoration, right? So really what we started out working with was the 3 C's of composite. Composite artistry, composite mirroring, contour, color, creativity. Again, I'd like to thank Dental XP for this opportunity, and certainly for Horea sponsorship also. So let's look at a couple of cases and finish this up on a couple of cases so you can see this technique again. So here's our patient. You can see her smile. There's some visual tension in the front teeth. You can see they're worn tremendously at the midline. They're rotated to the lingual at the midline. In the retracted view, these are the AACD views, right? And so you can see she doesn't also like the black triangle in the gingival third there, gingival half. So we'll try to close that up for her also. But you can see the wear, you see the ochre in the teeth and such. Let's look even more closely. Look at the depth of color in these teeth, the translucency that exists in these teeth. You can see the gingival third here, where there's concavity here, some type of erosive type lesion or so, some type of erosive type lesion there. And the fabulous translucency that carries up into the gingival third areas and such. So, to me, I call these kind of fun teeth to reproduce. So here we have the pre-op view, nice close-up pre-op view of the case. And now I've prepped the case, and you may wonder, well, why'd you prep the case? You have a couple options here. You have to remove the aprismatic enamel, so you can either sandblast the teeth, or you can take a coarse diamond. And all I did is just took a coarse diamond with my electric hand pieces, all right, the NSK Brasseler hand pieces, and just ran it across the tooth, just kissed the tooth. And so that just removes the aprismatic enamel, and it gives you a little bit more surface area. If you think about it, it gives you a little bit more surface area to bond to. We're bonding to enamel classically, pretty much most of the surface except for the incisal edge. But 90+% of this is enamel bonding, so we know that works very well. Now we're in shade selection, shade reproduction. So you can see we're trialing to me that looks like that should be a pretty nice match, very nice match. And so here we're using a sectional matrix gingivally, because that's what we're trying to close up that black triangle, and that's what I like to use. You can see the tooth has been etched, it's been primed and bonded. Okay, so you can use Horaeus's total etch system, if you like. And then we started layering. So we put a little bit of artificial dent. We need to block out the incisal edge. We block out the incisal edge here. And the gingival aspect there, or the interproximal black triangle, is we need to block that out nicely. So nice dent and shade there. And you can see, I always put tints down. Okay, if you ever see any restoration that comes out of my office, be direct or indirect, there's going to be some white dots, white lines, something, some maverick coloring, some tints. And then, and it don't show the next 2 layers, but a little bit of incisal translucency and a little bit of facial enamel over that. And then go through phase 1. Get the contour very, very close at that point. So get the contour about 80% there. Then we put some Teflon tape on the adjacent teeth, and we build up tooth number 9. So we did 1-1 first, got about 80% there, then put some Teflon tape protecting it. Now we're doing tooth number 9, 2-1. And you can see we have the dent and shade down, we have some tints down at this point, and there we put some incisal opalescence and some facial enamel on it. Now you can see the outline form that we have on tooth number 8 there. Now we'll start reshaping that back. And so there's roughly the outline form. That's maybe I have it maybe 80% home, if you will. So about 80% there. We'll do just a little bit more before we dismiss the patient today, but I only try to get it 80+% there, not completely done the first appointment. You've been staring at these teeth. Your eyes are a little fatigued. We're also going to do tooth number 10. So there's tooth number 10. Handled, changing the incisal edge effect and the incisal contour. And then there's a little preliminary polish. So that's actually how we send the patient home. And so you can see the trial texture that we put on these teeth. So I'm not really crazy about what's going on with 8 and 9, to be honest with you. I like what's going on with 10. 10 or 2-2 for our international colleagues. I like the texture that I was able to accomplish here. This will look very natural when I put a high polish. This up here also will look very natural. So that one's going to, I know, is going to come out very nice. This is going to need a little bit more work on the texture and such, and that's okay. Here's how the patient goes home. And something to think about, those restorations, you can see the maverick coloring in them is a little prominent right now. Right? The other teeth need to rehydrate. And as these teeth rehydrate, they're going to darken a little bit. So again, it says first appointment here. Now they come back a second appointment. And now you can see where we put some little bit more texture in that, smoothed up everything, and try to make these restorations seamless and undetectable, matching the tooth structure and color and translucency, and have the appropriate luster and polish. So I think we'd all agree that's pretty nice. And there she is with her natural smile. You can see some of the maverick colors in there. When you get close up, look at the full face view. These look like just natural teeth. You know, I always say if you met her in Starbucks, turn around and said hi to her, I don't think you'd guess that there's dentistry on her two front teeth. So there again, you can see how the direct bonding that I've done on 8, 9, and 10, the 1, 1, 2, 1, and 2, 2, I think blend in quite naturally with her dentition. Certainly there are diastemas between the laterals and the cuspids, and we may close those with orthodontics down the road, or we may do direct bonding, right? So finances play into this, and I do practice in Beverly Hills, and a lot of people think that, oh, you practice in Beverly Hills, people just do whatever you tell them to do. No, that's not the case. Everyone has a budget, needs to work within their budget, and that's really what we try to accomplish for our patients. So here's the before. You can see sort of what we call an aged before, and here's the after. Okay, and you can see the subtle maverick colors in these teeth, and some of the outline form things that we have some perfect imperfections, right? And let's look at our second patient, and this will be our last patient here for this session. Again, thank you to Dental XP and Horaeus for sponsoring and giving me this opportunity to share this information with you today. So here's Mary. You can see she's a delightful young lady, very outgoing. And it's very straight. The edges are worn. Got a lot larger abfraction lesion up there, which, we're not going to close that in. We're not going to cover that in because that's best served with a connective tissue graft. And certainly, in my opinion, but you can see the asymmetries here. And certainly in the close-up, you can see, again, the asymmetry. So we're going to restore 9, 10, and put a little bit more tip on 11. And that's what we're going to do. 9, 10, and 11. So 2, 1, 2, 2, and 2, 3 is really what we're going to restore here. Mostly focusing on 2, 1, and 2, 2. And so photography, how that aids me with shade selection. Okay, how the photography aids me with shade selection. These are the 3 shades that we're thinking about using. Dentin, obviously, translucent and enamel, most likely here. And then these are them light cured. So there's a color shift when you light cure them. So be aware of that, And don't have time to go into all of that. But here's my color mapping of the case. And then you can see the outline form that I was able to create. Got a rubber dam isolation here. And the patient's had the rubber dam on for probably about an hour at this point, somewhere around there. But you can see we got pretty nice with Venus Diamond, pretty nice outline form here. Don't have the luster and polish quite nailed down yet, but very close. Now here we are. Here's how the patient goes home. So you can see the restoration on 9, 10, and 11. There's how the patient goes home, the first appointment. Right? So you can see, we're 80+% there, 80+% there, and that's always my goal. Using the putty matrix. Okay, using a starburst bevel. So there you have Mary now, our patient here, where we restored 9, 10, and 11. 9, 10, and 11 here. I think you'd all agree that blends in pretty nicely. And that's really close-up view. We got these teeth, 1 inch, 2 inch is tall. Interesting. So we go from there before to there's the after. So I think we'd all agree. Pretty nice result using Venus Diamond. So awesome. Notice the maverick colorings. Notice even the small craze line I was able to put in that tooth there. Just really kind of having fun, what I call contour, color, and creativity. The 3 C's, contour, color, creativity. Creating these three teeth in a 3-dimensional world. So, summarizing. Composite mirroring, really what I've really tried to share with you over this, little under an hour or so. is the 3 C's: contour, color, and creativity. Right? How do you accomplish those? Hopefully I've shared with you several techniques to making these seamless, undetectable restorations, restorations that match the tooth in color and translucency, that have the strength for the long term, are seamless and undetectable, and have the appropriate luster and polish. How do we pull that off? Really, I hope the 4 techniques, one is putty matrix, then certainly you have your starburst bevel, right? Then you have your layering technique, and then you have your finishing and polishing. Here's one last case. This is using Venus Pearl, so the new material. So Venus Diamond is the other cases I shared with you. This is Venus Pearl, and you can see, you might look at this and go, well, that's kind of a simple case. It isn't a simple case. These small cases here are actually harder cases, in my opinion. So we just smoothed off the incisal edge of tooth number 8, and tooth number 9, we rebuilt in the incisal edge here. So here you can see, just smooth this edge off here, and then we reestablished this whole edge. You can see across here, and we probably took it way over here. And you can, at this view, you can see a little tiny seam there, but think about that when there's a little saliva on there. But look at the fabulous color and translucency match here, and look at how nice and dry the tooth is, perfectly dried teeth. Did we match the color? And translucency, and we get the appropriate luster and polish? So with that, certainly here's my contact information. As I mentioned, you certainly have the behi.info. That's my website. That's my institute. You're looking at my institute. I teach composite courses there and around the country. Certainly come visit the Dental XP meeting in Vegas. I'll be doing a hands-on workshop there and giving a little composite lecture there also. If you want to contact me personally, there's my personal email, brian@cosmetic-dentistry.com. And certainly if you want to call the institute, there's a telephone number. But if any questions come up, please don't hesitate to email me, brian@cosmetic-dentistry.com. Again, hopefully you have a great day. Hopefully I've enhanced a little bit of knowledge, and you can add these skills to the skills you already have in the world of composite artistry and the field of aesthetic dentistry. So with that, I say thank you very much for joining us. Appreciate the opportunity with Horaeus and Dental XP. Have a great journey in dentistry. Thank you.